Next, we're speaking to Dr. William Song. Dr. William Song practices aesthetic as well as regenerative medicine, and he's a candidate for the Associate Professorship of American Academy of Stem Cell Physicians. Hello and welcome, Dr. Song. How are you today?
Hi, Dr. Farshchian. I'm doing well, but the state of New Jersey here, we've had a really rough couple of weeks. As you know, we have New York and New Jersey has the highest number of cases, and unfortunately the highest number of deaths from this COVID-19. And we here in New Jersey are right in the center of it. And unfortunately, most of us know somebody who's died from it, and all of us know people who are sick from this. So this is very real. And no matter what you're doing, whether you are a frontline worker or you're somebody staying at home, sheltering in place, this is something that's very real to us. So, so I'd like to talk today to people out there that might not be as affected as we are on some of the things that that we can do to help protect ourselves.
What's your opinion on the testing? How important is testing in your opinion?
Yeah, the testing has been very frustrating because we haven't been able to get our hands on the test kits. And I think the testing is going to be very important because we have a lot of sick people and a lot of attention and effort is being placed on the people who are downstream, people who are dying, people who are on ventilators. But if you look over here, I just made this diagram. So for every one person who dies from this disease, we have 50 people that are infected, and it could be a lot more. We don't know because we're not testing the general population. When we get the testing available and we can do some testing of people who are not sick, then we can get some real answers. Then we can figure out what are these people who have the virus but are not sick, what are they doing? What are they not doing that they're not getting sick from this? And that could give us a clue on how we can treat this and how we can prevent people from getting sick. And we can save a lot of lives by looking at the people upstream here before they get sick.
Can you go over that diagram one more time for audience out there?
Yeah, so if we're assuming a 2% mortality in this disease, that means for every one person that dies, we have 50 people who are infected. And of those 50 people, not everybody is showing symptoms. We have a lot of people, probably a lot more, that are infected that are not showing symptoms. So, so if you look at the numbers here, we can't just concentrate here. Of course, we want to save the lives of the people that are dying, but if we can prevent these people from getting to here, we can save a lot more lives than we can with the respirators that are we're only saving about 20% of the people who end up on a respirator.
What is some of your recommendations regarding preventing the patients to get sick or infected?
Yeah, so some of the measures that we take for the common flu and other respiratory infections, the same principles will hold true. Things like not letting yourself get, not letting your temperature drop. If you've always, been told to stay warm, especially as the weather gets nicer, people go outside in shorts and t-shirts and let their temperature drop. And that's going to suppress your immune system and allow the virus to take over, because we're going to get exposed to this virus as well as other viruses, and our bodies are designed to fight these. So whether it's COVID or influenza, if you get a few viral particles into your system, your immune system is going to be the best weapon in fighting it off. And if you allow your immune system to fight it off, you may get rid of the virus before you even know you had it. So if you keep your temperature from going down, and another really simple thing you can do is you can gargle. I mean, we are very careful now about washing our hands, but the, the virus can only go in through your mouth or your nose and possibly your eyes. So if you gargle your mouth frequently, especially in the morning or in the before bed, you're going to decrease that viral load, and your immune system is going to have a much easier time fighting off a few viral particles than trying to fight off a load of virus that has replicated inside your mouth. So just washing it out can help you prevent you from getting sick. And then, of course, there are other things that we can do, things like taking vitamin C, vitamin D. Those are I recommend those because they're very simple and inexpensive. There are other things that we could do that at this point it's kind of debatable about which treatments are the most effective, and that's what we're trying to find out here at the American Academy of Stem Cell Physicians. We actually all over the world. And we're sharing our data. We are talking. We are on the phone. We are on our WhatsApp group, and we are constantly, all day long, I'm getting the pings from the WhatsApp, and people are so excited about the different possibilities of how we can fight these things. And at this point, there's so many possibilities.
And you got to be careful out there for audience out there, because there is a lot of misinformation out there as well. So just got to look at the correct information. I think gargling is very important. Gargling, you could gargle with salt water. You can gargle with hydrogen peroxide. You can gargle with ozonated water. That's something that is getting a lot of attention right now in Spain, in Italy, in Brazil. The doctors are using their ozone as an intravenous measure to combat COVID-19. So there's a lot of ways to gargle, and you got to do that not just one time. You got to do that a few times. Yeah, maybe every 3 hours, every 4 hours, religiously. You could.
Yeah, and it doesn't cost. The best thing is it doesn't cost anything. You know, it's easy to do, and there's no risk. There's absolutely no risk to gargling.
Yes.
So
that is the first step.
It's worth doing.
No, that is the first step. That's the first phase. You do that. Now, let's say you wake up in the morning and you got this sore throat coming to you, and 3 hours later, you get a fever as well as a cough because you got a postnasal drip. And you're concerned. I mean, you are seeing it may not be COVID-19, but it could be very well. That is the crowd that on your diagram, I think you have it on yellow color. Is that correct? The green color. Yeah, the green color. Here, the patient needs to be vigilant. They gotta, they gotta go see maybe their physician, and maybe more importantly, an alternative medicine doctor who does practice intravenous vitamin C or does alternative care. That is what I recommend to patients out there, that if you fall in the green line, that's what you want to do. You don't want to go lower and become part of the red, because, once you end up going to hospital, if you are stable, they're going to put you on oxygen. If you're unstable, they're going to put you on the ventilator. Once you're on ventilator, even if you survive it, there is some damage there. You're not going to be the same person, all right?
Absolutely, absolutely. And I think, if you start having symptoms, unfortunately, we're going to have to just assume that you have it. If you have a sore throat, you have fevers, and in this environment, we don't have the luxury of going to the doctor and being tested. There are just too many people. You'll be turned away. So the process here is you call your doctor, and maybe you'll get a telemedicine visit, but they'll tell you to stay at home, rest, drink a lot of fluids, and you're probably not going to get any real specific advice on what to do. But you have to really seek out the doctors that do know how to treat these things. and we've been doing it for years before COVID came around. Things like the vitamin C treatment, and we're talking about high dose vitamin C,
Yes.
like IV.
Yes.
So these are treatments that may not necessarily be offered at your regular doctor's or even in the hospital. And that's something that we're having that's been very frustrating, because we know there are treatments with minimal risk, like treatments with stem cells and exosomes, that could possibly help prevent these people from going onto the ventilators or even getting them off. But we don't get any support in the hospital. I think the administrators and doctors at the hospital are afraid of getting into trouble from using an unconventional treatment. But I think we really need to push for this type of treatment, because the risk is minimal. The risk is minimal. We've been using IV stem cells and exosomes for other conditions with very, very little side effects.
I certainly agree with you, especially about the tests. Right now, we know that some of the tests out there, they have false positives, they have false negatives. So as soon as you get the symptoms, you just have to not just assume, you just have to believe that you have COVID-19 and start stopping the virus from traveling south from your sore throat becoming a pneumonia, because that's where the big problem is.
Yeah, and the best weapon that we have to fight this thing is in our bodies. It's our own immune system. There's no drug or treatment that's gonna work without our immune system. Our immune system is how this virus is going to be beaten. For example, I mean, if theoretically we all stood still for 3 weeks and nobody came in contact with anybody else, the virus would be gone from the planet, because every person who's infected is either going to die or their body's going to kill the virus off. And as long as it doesn't go to another person, the virus cannot survive. And that's why it is important for us to continue to be very vigilant about not spreading it.
Well, thank you so much for joining us. If you guys want to know more about Dr. Song, please visit the website WIPE COVID, that's WIPE COVID.com. Again, thank you for joining us, Dr. Song.
Thank you so much.
Have a great day.
You too. Stay safe.